ECG ECG full form means electrocardiogram. It denotes the electrical activity of heart on paper. The first topic we discuss is about ECG machine and paper. The paper inside ECG machine will be on speed 25 millimeter per second, and its calibration speed, and it will be calibrated on 1 millivolt. So basically ECG machine paper shows box, and one small box means it denotes the time 0.04 second, and the voltage on one small box is 0.1 millivolt, and one big box time is 0.2 seconds, and the voltage for this one big box is 0.5 millivolt. 5 boxes is equal to 1 second, and 300 boxes means that it recorded the electrical activity of heart for 1 minute. ECG machine is having 12 leads, which includes 6 limbs leads and 6 chest leads. Normal ECG waveforms. The normal ECG waves which forms on the paper includes P wave, Q wave, or S and T. P wave. The P wave time period will be 0.08 seconds to 0.1 second, and it is formed during the atria depolarization. Normally it will be in the upward. It will be in the upward in lead 1, 2 and AVF. It will be less than 2.5 millimeter, and it will be wide 0.12 seconds. PR interval. PR interval is this one is PR interval. It will be 0.12 seconds to 0.20 seconds, and it will be 3 to 4 3 to 5 small boxes. Number 3, QRS complex. QRS complex. This complex will be less than 0.12 seconds, which means that it will be less than 3 small boxes. It is basically formed between when the ventricles depolarize. ST segment. ST segment forms from J point to T wave. It's elevated. It may be elevated or depressed. When it is elevated, it means there may be ischemia of the heart muscles or injury, or maybe electrolytes imbalance. T wave. T wave is formed when the ventricles repolarize. It is basically normally upright, but if it is very tall, so it means hyperkalemia, and when it is very small or inverted, so it means hypokalemia. QT interval. It's basically from QRS to the T wave. Normally it is less than 0.44 seconds, and it is prolonged, so it means that there is risk of Torsades de points. Now ECG basics. So ECG include, we first of all, when we receive ECG, so first of all we see the rate, rhythm, axis and any ischemia. So for rate, we shall see that whether it is normal or tachycardia or bradycardia. If the rate is 60 to 100, then we will call it normal, and when it is tachycardia, so it will be greater than 100. Tachycardia can be in the pulmonary embolism or fever. Bradycardia, so when the heart rate is less than 60, it will be known as bradycardia. It will be in hypoxic late injury or when there is heart block. Formula: how can we calculate the rate? So for rate we shall take 300 divided by number of big squares between the r between the two r waves, or the next formula is 1500 divided by number of squares, which is number of small squares. Okay, then we will come to the rhythm. For rhythm we will see that whether it is sinus. So for sinus we will see that every QRS wave shall be followed by the P wave, so then we will call it as sinus rhythm. In AFib or atrial fibrillation there will be no P waves and the rhythm will be irregular. In SVT or VT there will be no P wave and the QRS will be wide, so we can call it wide complex tachycardia. In atrial flutter there will be sawtooth appearance. So in this all the rhythm will be, we will see the rhythm axis. For axis, normal axis shall be -30 to +90 degrees. When there is right axis deviation, so right axis deviation is when the greater than 90, when the, and left axis deviation when there is less than -30. So left axis deviation occur in the left ventricular heart failure. Right axis deviation occur in pulmonary embolism. And number 4, ischemia or infarct. For ischemia infarct, we shall see the ST elevation, which basically occurs in the myocardial infarction, or ST depression or T wave inversion. These all occur in the myocardial infarction. Thank you.